Hi, I'm Taylor Landgraf, dentist at Washington Courthouse Dental, and we've got Caitlin here today. We're going to be going over some questions about pregnancy and dental health care. We get asked a lot if there are extra precautions that need to be taken if you're pregnant and you're worried about coming into the dentist. The first thing that we always ask you to do is check in with your OB and fax over a dental release form or an OB release form so that they know that you're going to go see the dentist. And your OB will be glad that you're going to go see the dentist. They want you to have a checkup during your pregnancy to make sure that you have a low bacterial load in your mouth and you're staying healthy. A lot of pregnant patients will come in and they'll say that their cleaning was maybe a little bit more uncomfortable than usual. It's not necessarily because they were behind on their oral health care at home, but because during the pregnancy there's some hormones that are released that'll cause inflammation of the gums. And we want to help stay on top of this and provide a dental cleaning to make sure that those gums are staying as uninflamed as possible and keeping the moms comfortable during the pregnancy. I think it's totally normal to have some dental anxiety, whether we're pregnant or not. I think everybody, myself included, feels a little uncomfortable sitting in the dental chair. Focus on the fact that these dental providers are really care about your oral health and your oral hygiene. We want to coach you, we don't want to shame you, we want to make sure that you're staying out of pain and that your mouth is comfortable and healthy. And you're also getting prepared to set an example for your newborn because in a couple of years you want to be ready to take them to the dentist. This is also a great opportunity to start asking some questions about what's going to be in the future for taking care of your kids' teeth. So during the pregnancy, the biggest thing that we're worried about with your oral health is mostly just the mom's pain. Any kind of dental pain can increase blood pressure. We could also have like heavy plaques and tartar buildups that can put the mom at risk for heart disease, and that's something that we're concerned about during pregnancy. We don't want the pregnancy to turn into a high-risk pregnancy, so it's important that we're coming in for cleanings and keeping any disease process under control. We're also worried about once that baby's born, any bacteria that's in the mom's mouth can be transferred to that kid as we're sharing pacifiers between the mom and the kid, or if we're like kissing that baby, any of the bacteria that causes cavities or gum disease can get transferred to that child. So we have a lot of moms that come in and they need to have some kind of treatment done, whether that be x-rays, cleanings, or dental extractions or fillings done, and they're always trying to weigh out, like, is this something that I should be doing right now, or should I wait until after the baby's born? And we do weigh out that there are some risks for doing dentistry, but it's very minimal. The studies have shown that there's really no concern with any of these treatments done. The biggest thing is that whenever we're taking x-rays, we're going to be using a lead apron to shield the mom and the baby during those x-rays, but otherwise any treatment that we typically perform in the dental office is safe to do during pregnancy. Yeah, we have a lot of patients that come in that are pregnant and they need to have some treatment done, and we obviously want to make sure you're comfortable during that treatment. And in order to do that, we've got to anesthetize some of the areas that we're working on. It's totally safe to use small doses of anesthetic. We always are mindful about the fact that our patients are pregnant, and we try to minimize the amount of anesthetic that we use, but it's totally safe for both the mom and the baby. Just one last note, I think that it's normal to have hesitancy about going to the dentist, but if there's any time that you should really consider going back to the dentist and getting that habit back into place, it's while you're pregnant. Because it's in these times that you're realizing that you are going to be setting up habits and values for yourself and for your children, and we want to have happy, healthy smiles for yourself and for your kids for the next generation.